So complete denture steps. There's a clinical steps, there's lab steps. So the first clinical step, the patient go to the dentist. He doesn't have teeth, he needs complete denture, okay? The dentist will take history, they take x-ray, they take the money, they take all this insurance stuff, but they examine him for medical stuff, but the main thing, they will take impression. They call primary impression. Or first. Okay, first impression. He will send you the first impression for the lab. What you gonna do with the first impression? He will send you the impression. You pour it with the stone, and you make
instruction
a steady cast. You make the cast. On the steady cast, the first impression, the primary impression is not really very good. So the dentists usually they need a special tray. So we make special tray. On the steady cast, we make special or custom. Some people they call it a custom tray. Remember we did it in lecture, the tray with the handle, okay? And some people they need it with the space with the wax. Some people need it perforated. Depends on the dentist what the dentist wanted. Great. So we made a custom tray. We send it back to the dentist. The dentist will check this tray if it's sharp. I told you it should be smooth. There's no roughness. Should be fit on the area. And we make the dentist will make secondary or final impression. This impression will be very good. He sends it back to you. You pour it. You make a master cast. This master cast is very important because you're gonna make the denture. Okay. So sometimes some lab, if you're a beginner, make 2 of them. You make double. Remember, you can duplicate the cast, make it 2. So if you lose it, break it, you have another one. Okay? So the master cast. The other thing with the patient when they lose their teeth, they lose their vertical relation. They lose relation between lower jaw and upper jaw. Their face will be smaller. Because the bone shrinks, the lips go down on it. So we need to make something from wax, made of wax, to make a record. So we made a record base, upper lower record base. Remember with the wax, this one? Depends on it. Remember, we made the denture base and the wax. And we have measurement. Remember the measurement? 22, 18, we're gonna go through that. So this is a record base. We made a record base. So this one will record the relation with the lip. If you put too much wax, the lip will go forward. If you put too much less wax, the lip slips backward. So we put this wax and send it back to the dentist. He put it in the patient mouth, and the dentist will measure. If you put too much wax, the patient will look very ugly. So he removed the wax. If the lips push forward, he removed some wax, so it will be perfect. Okay, on the cheek, and also the teeth will affect pronunciation of the letters and words. So the dentist will tell him pronounce M, V, or whatever, and he will remove wax until the patient will have perfect sounds. Okay, so the dentist will remove some wax, he adds some wax, depends whatever. And this is he do the measurement or the recording. So he do the recording relation between upper and lower jaw. He will send it back for you. The upper and lower they will become. He send them back fused. This is the relation, and he removes some wax. He adds some wax, depends on it. He will send it back to you. Usually he will send it back with an articulator. He sent it back to you. I think this one is not very. He sent it an articulator, the measurement, and everything related. And he sent it back to you. What are you gonna do? Now we set it. Okay. We set up teeth, but they are in wax. So we call it trial denture. Also, the dentist will choose the color of the teeth, the shape of the teeth, and he sends it back to you. So you set up teeth. You set up teeth, the trial denture. We tried, we set up the teeth on them, and we send it back to the dentist. Now he tried the denture with teeth with wax, and he checked the midline, checked the pronunciation, checked the cheek, the extension, the occlusion. He will check. If everything okay, he send it back for you for processing. Make final or packing. We do packing, we do processing, make the final acrylic denture. Okay, we have acrylic denture ready, acrylic denture ready for insertion. Send it back for insertion. He put it in the patient mouth, and there's another step. Most of the patients, when they insert the denture, they have, either there's a sore, there's hurt, so after a week, the dentist might send it back for you for adjustment. Because it might be adjustment, there's roughness. Some dentists, they do it by themselves, but sometimes the dentist will send it back for you for adjustment.
Wow.
How many steps we have?
5.
5 steps? 1, 2, 3, 4. Yeah, 5 steps. But this is the steps, the general steps. I will print it for you. We have a printed version.
So the answer is not.
So which one? Set up teeth. 1, 2, 3. Third steps we set up teeth. Okay. First we do the special custom tray. The second we do the record base, and then we set up teeth for the third one.
Okay.
And fourth one we finish the acrylic.
So the.
And there's adjustment, always there's adjustment.
So we're only counting the lab side and not the clinical side then?
But the problem is you're not dentist. You are not. If you are teaching as a dentist, I'll teach you this thing. Okay, but we count the lab stuff. Okay? Yeah. So
Set.
it's number 3.
The.
All right. Okay.